Hey there! Today I'm diving into a crucial topic for healthcare professionals in Egypt: admission consent according to GAHAR guidelines. Admission consent isn't just a formality, it's a fundamental legal and ethical process that aligns with global healthcare standards. So, let's break it down. First up, this means providing patients and their families with all the necessary information about their hospitalization. This includes the nature of the medical condition, proposed treatments, risks, benefits, and alternatives. It's not just about handing over a form. Healthcare providers need to explain everything in a way that's easy to understand, allowing patients to make informed decisions. Next, let's talk about the GAHAR emphasizes patient autonomy, the right of patients to make decisions about their own care. Admission consent ties directly to this principle. Hospitals are legally required to obtain consent before admission, and failing to do so can lead to serious legal consequences. Standardized, legally binding forms ensure that both the patient and the healthcare provider are protected. Now, onto the admission consent covers the entire hospitalization process, including diagnostics, surgeries, medications, and more. It also involves financial and administrative aspects like billing and insurance coverage. Patients or their families need to acknowledge these responsibilities as part of the consent process. Communication is key, which brings us to GAHAR stresses the importance of culturally sensitive communication. Consent should be obtained in the patient's native language, avoiding medical jargon. Professional interpreters should be used if necessary to ensure clarity. Family involvement is another critical aspect. Is allowed for patients who can't give consent themselves. A legally designated proxy, like a family member, can provide consent. This reflects the cultural importance of family in decision-making. What about if a patient refuses treatment? This is a key part of admission consent. Patients can refuse hospitalization or specific treatments after understanding the consequences. This refusal must be documented, ensuring that patients are aware of the potential risks. Finally, consent forms are a critical part of the patient's medical record. These documents are essential for auditing and legal purposes. GAHAR may conduct compliance checks to ensure that hospitals follow the required standards. In summary, admission consent according to GAHAR isn't just a legal requirement. It's a comprehensive process ensuring that patients and their families are fully informed and involved in healthcare decisions. This process upholds patient autonomy, legal accountability, and ethical practice.